I'm Peyton. I'm your potential therapist. Can I ask you what your name is?
Yeah, hi. My name is Alec. I'm here seeking therapy just because I've been having some problems in my personal life here recently.
Well, a little bit about kind of how this works before we get into a ton about you. My kind of theoretical orientation sort of thing, I'm a feminist therapist. Basically, that means I focus on empowerment of the individual seeking help, kind of understanding the education from a psychological perspective, kind of giving you tools, as well as forming egalitarian relationship, which basically means we're going to kind of be equals in this. We're not going to be I'm not in this higher power. And so does that sound like something you'd be interested in doing, or is that not quite a fit for you?
Yeah, no, that sounds interesting for sure. It'll be kind of nice to make a personal connection.
Yeah. So it's kind of what I focus on. It's called feminist therapy, but it doesn't necessarily mean it doesn't apply to you. Feminist is just kind of the word that it came up with. So we're going to be talking about the not so fun stuff today. Before we get into more about you. So first we're going to have to talk about the fee structure. Each session is going to be about a $20 copay. Before coming in, we checked your insurance, and the rest is covered, so that $20 copay is just the last of it.
Sure.
Does that sound okay to fit with your budget?
Yeah, that sounds great, actually. That sounds much cheaper than what I've been hearing.
I know, we've been striving to having affordable therapy, hopefully, and it seems to be reaching people.
Sure.
For any kind of rules for how therapy works, all I ask is that you give me 24 hours notice before if you have to miss, if that's at all possible.
Sure.
Failure to do that for anything other than some sort of emergency condition is going to result in you're going to have to pay the $20 anyway.
Sure.
It's just because it's my time and I need to know, so I don't end up coming in and there's no one here. That would not be kind of very fair, but that's just all legal jargon. But does that sound okay and work?
Yeah, that's perfectly understandable.
Yeah,
that makes sense.
And again, it's not like we're gonna work with you. We're gonna be understanding. It's not like we're trying to screw you over.
Yeah, absolutely.
So we're going to talk about a little bit of confidentiality stuff. So as a therapist, I am confidential. Anything you say in here stays in here. It doesn't go anywhere else. If I were to see you in public, it wouldn't pass between us anything that we've talked about in here.
Sure.
This is with an exception of 2 cases. If I'm required by court to talk on your behalf or behalf of another, or if I were to believe there was serious danger of harm to yourself or to others. So with that, I have to ask, do you have any thoughts of completing suicide? Do you have a plan, anything like that?
No, not at this present time.
Okay. So we're going to talk a little bit about medical history, just so I have it for my records. Is there any history of mental issues in your family or medical ones, so physical?
Sure. Physically, no. I suppose my parents, my grandparents have some history of cardiovascular disease, but that's about it.
Yeah.
Mental health-wise, I know my mother has struggled with depression and anxiety as well in the past. She suffers mostly from seasonal affect disorder, but she has had generalized depression in the past as well. My father, none as far as I know of. And my half-brother, on my mom's side, he is bipolar and has some issues with post-traumatic stress disorder.
Okay, got a wide range there.
Yeah. It's okay. Yeah, my family's a little interesting sometimes.
We all have them. That's totally okay.
Yeah.
Everyone has an interesting family.
Yeah.
Okay, so we have a little bit of history there. With all of that, is that why you came in, or is it more personal, push?
So, yeah, my mother's history does concern me, especially with my brother. He's only my half-brother, but he has had some more serious mental health problems in the past. That was mostly related to drug use, more than it was actual genetic things, we think, though. However, yeah, with my mom, it is kind of concerning. I've had some issues at work recently with sort of upticks in what I think might be anxiety. I noticed that, my heart rate's starting to elevate. I can feel myself breathing faster. When I get into large crowds, and then personally too, I've just noticed a lot of, I'll go through and I'll have just a quick, easy talk with somebody, something that wouldn't be outside the realm of just a normal conversation, and I'll find myself an hour later sitting at home, just being oh, I think I thought I was stupid, I think I thought I was an idiot, I messed up, I said the wrong thing, and they probably didn't even notice. but I just these irrational thoughts and sort of obsessions over just like social interactions and all that. But otherwise, I was a little concerned whenever I talked about my mom and I heard that she had some similar problems with social anxiety.
Yeah.
Hers is mostly to deal with crowds. She can't handle crowds like at all. I've noticed that sort of the same thing too.
Same sort of thing?
Yeah.
Okay. So, before you came in today, we had you fill out the DASS. Can we talk about a little bit what you experienced from that and what your takeaways from that questionnaire was?
Sure. Yeah. So it was pretty simple. It seemed really straightforward. I haven't had much history in the past with seeking treatment for anything like this. I've had no prior health care. So something like that was pretty new to me, but I did kind of expect those scores. I kind of know what anxiety is. I know a little bit about social anxiety. Yeah. So coming in, I kind of expected that sort of to come up. I noticed my scores were a little higher. I maybe scored higher on depressive symptoms than I thought I would. But yeah, it's about what I expected going into it.
So outside of your medical history, what made you think that, what experience have you had that made you think that, you might score higher on that questionnaire?
Yeah, so like I mentioned before, just when I go home or after I have an interaction, I'll notice myself overanalyzing, and then I can feel physical symptoms of just an increased heart rate, or I feel myself sweating, and just really. It's just really rough sometimes when I'll get into situations in which I think that someone has judged me really harshly, or that I think that I messed up somehow. I'll start to have that kind of sort of negative self-talk and just really bad issues with that. But I suppose the really big thing that caused me to seek treatment recently was there was an incident at my work recently where it was a rather busy day. We had a lot of people coming through, and I could feel myself sitting behind the counter in this giant crowd of people. Sweating, my heart rate going up. I could feel myself getting short of breath. I almost mistook it for a heart attack at first, until I stepped out and I just collected myself, took my breath, and I still wasn't able to calm down for several hours afterwards. And it was really concerning, and it was just one of those things where it's just oh man, I should probably really go get help for this now. If it hit this point, it's not okay anymore, because I've sort of been just pushing it back and just waiting and just be I'll go handle that eventually. It's whatever. I know how to cope with it. But yeah, mostly it's been a recent history of that panic attack, and then I've noticed I haven't been able to quell those thoughts as easy. Normally I'm able to just, I know it's irrational, and just push it aside. They probably didn't think that, but it'll just keep surfacing and surfacing sort of thing. But yeah, so that panic attack, and then just really, it's kind of been, I've noticed my anxiety that I thought was at the normal levels is getting a lot worse recently. Yeah. And then taking that questionnaire there and seeing that score was pretty high for anxiety. Makes sense. Yeah.
So this was all this was recent, yes?
Yes, this was a recent history.
Did you experience anything like this when you were growing up as a kid? Anything that you might think that makes you dislike crowds like this? Any for lack of a better word, any trauma that had come up?
Maybe nothing traumatic. I mean, I've noticed my mom would sort of feel like this before, or if we got in a large crowd, she would show similar sort of symptoms. She'd try to leave. So maybe it's something to do with that. As far as just my general social anxiety goes, I mean, I guess I myself am a bisexual man. So when I came out in high school, I suppose I suffered a lot of just backlash from that I still am sort of kind of walking through those problems and dealing with. Of just, so it's definitely an issue where every now and then I'll have a poor interaction with someone and I'll leave and be oh, is that because they know that I'm bi or that I'm dating a man sort of thing? Because I'm pretty open with it. I don't try to hide my sexuality. And I just remember in high school I suffered a lot of really bad just homophobic backlash, a lot of just slurs just being yelled at me. Really kind of rough stuff growing up in a more rural area. Yeah. And so I've noticed that, sometimes my social problems do come from just I don't know if someone's judging me because of my sexuality or not, or if it's just because of me as a person sort of thing. There's been some issues in the past, at least with my sexuality, when it comes to just kind of poor social interactions. Yeah,
and I can understand that. So I've been out as a lesbian since I think high school, something like that, and I received a ton of backlash and stuff like that from my family, from people at school. I don't know that I had it quite as much. I know bisexual men have a really bad time kind of validating it for some reason,
Absolutely.
which is absurd. and so I understand where you're coming from, and I can relate to that experience.
And that's good to hear. Yeah, it's always
Yeah.
good to kind of have that similar experience there.
And that's what I'm
yeah.
here for you for.
Oh, that's good. That's good to know.
So moving kind
Yeah.
of with all that, it's important to recognize that like that kind of history leads to feelings of anxiety and shame and fear of other people, even if it's not like a sure pointed way that you recognize it as anxiety and stuff, and that's a really good thing. That's kind of one step closer that brings me to helping you.
Yeah.
So hearing all of that, like what are your goals coming here? Like what do you want to accomplish?
Okay. So I suppose my main reason for showing up, and the most immediate, is like, yeah, I want to get rid of those panic attacks. I don't want to sit through that again. That was rough. I don't want to deal with that again. But the other thing too is I just want to learn to stop over evaluating, like obsessing on social interactions. So I want to stop like getting home from something that was otherwise like say over the weekend I had like a great party and I would have had an awesome time. It would have been super fun. I would have felt great connection to all my friends and all that. And then I'll just start to tear that apart after I get home.
Yeah.
And it'll sit and it'll just be like, I think that went terribly. I think they judged me. I think it really went bad.
Yeah.
And I'll really just ruin what could be like otherwise like a good experience just from that. So I want to stop that, like first and foremost. I want to stop overthinking and sort of obsessing on those sorts of things. And just, I want to make sure that it doesn't hit a point where it becomes like a panic attack. I want to make sure I can cope with that.
Yeah.
Yep.
Okay. That sounds like a really great goal, and it's definitely something that we can work towards accomplishing here over the course of however long this kind of takes.
Yeah.
We've been talking for a little while now, so I kind of wanted to check in. How are you feeling about like this whole thing? What are your thoughts or feelings towards us, like us pursuing this, and then like the questions I've been asking? How you feeling?
Sure. So I kind of wasn't sure what to expect. I've never been in a counseling session before, so I didn't know what to kind of expect when I walked in today. I definitely really like that you're coming from a similar place. It kind of helps to get another queer perspective on a problem like that. I was a little worried about that because I kind of had a feeling that might be some of the issue and what's causing it.
Yeah.
So it definitely helps to have someone that can reach out that way. But otherwise, I think it's been. I think it should work pretty well. I think you seem like you know what you're talking about, and that you seem like a good fit for kind of the problem I'm having.
All right, that's a good thing to hear. Okay, so just to make sure that I'm understanding things, I'm going to kind of restate what I've heard is the problem for you, and then you're going to kind of say yay or nay to me.
Sure. Yeah.
And then I'm going to try and talk to you about what I believe is causing these. Okay. So you've expressed that you experience anxiety, especially in social situations, and then over-analysis, sort of when, after talking to people for extended periods of time, being unable to like quell these. You also mentioned panic attacks, feeling increased heart rate, sweating, all that sort of things. You mentioned feeling like you're having a panic attack. All of these are kind of pointing towards these anxiety, panic attacks, all those sort of things. From my perspective as a feminist therapist, I'm led to believe that these problems can be stemming from like the impact that being a bisexual man has had on you, and and how that coming out experience in high school impacted you, and how that was a negative experience for you, and this has led to these negative feelings. Does that sound kind of accurate to what you're experiencing?
Yeah, I feel like that's a good sum up, and just kind of because that's probably a good indicator as to why I'm having these feelings today.
Yeah, as from a societal sense, LGBTQ people, we experience a lot of shame, and we need to feel as though like what we do is perfect, so that other people like us, and that we don't make people ashamed of us or anything like that. So from a societal sense, this is totally normal, especially for someone of the queer community. It's a totally normal thing. So I want you to know that like this is not insane. You're not crazy. You're not alone, and that's a really important thing for you to know. Aside from that, is there anything else you wanted to talk about in relation to your experience coming out, your anxiety, anything like that? Anything that I didn't just touch on, or anything at all?
It's definitely a lot to go over and think about, but I think sort of we hit the major points. Everything that's come to mind that I want to talk about today, I think we've kind of gone over already.
Okay, that's good to hear. I'm glad that we're kind of reaching the same page here. So for next time, given all of that, we kind of want to talk about diagnosis. Now, I'm not a psychiatrist. I can't formally diagnose you, but I am a professional who has experienced these, and I've been working with people who have been formally diagnosed, so I understand what it looks like. I do believe you have an anxiety disorder or a panic disorder. And you don't have to go to a psychiatrist. You don't have to receive medication. From what you've talked to me about, it does sound like this is something that you could treat through therapy, through talk therapy. But if you were interested in pursuing medication, I could recommend you a psychiatrist to talk to. We have one in the office that you could go speak to about this. But I also want to talk about a little bit, before we kind of move on, what a crisis plan would look like. So let's say sometime this week you're starting to feel panicked again. Let's talk about what you can do to calm yourself down before you come talk to me again.
Okay.
So that would kind of look like deep breathing. You talked about that earlier. So clearly you kind of know, like, you know these feelings. You're going to try and take deep breaths. You're going to take in your surroundings, start identifying things. A good way to do that is, we're sitting in this room. You could tell me, what color that plant is. You could tell me what shape is this table, that sort of thing.
Yeah.
Ground yourself in the situation,
Okay.
make yourself present in the moment is a really good strategy to dealing with those feelings of panic. And if anything else, there are resources you could reach out to if that doesn't help. But I do think that will be ultimately pretty helpful to you.
Okay.
Does that sound like something realistic for you? Is that a plan that we could make?
Yeah, I think that would be easy enough to go through. Especially medication worries me a little bit, but
Yeah.
I think just talk therapy I'd be comfortable with.
Yeah. Talk therapy is very fun. And being scared of medication is also totally
Yeah.
normal. And again, if it is something that we can look into treating through this, it would be most beneficial to you.
Sure.
So one last thing we're going to hit on for this session before I send you on your way for the week. I'm going to give you homework. It's not like school homework. Given what we talked about this session, I'd like you to try and find like an LGBT support group around the city or something, and just sit in on a meeting or a session. You don't have to feel pressured to say anything,
Sure.
But just go and just see how the environment feels. We want to try and build you a support system of people more like you than maybe the crowd that you're used to seeing on a college campus or anything like that.
Okay.
Does that sound like kind of something that would be a good plan?
Yeah,
Yeah.
I'll definitely have to force myself a little bit to get into that, but for sure, I think that's definitely something I could at least go and sit in on it.
Yeah,
Yeah.
definitely. It's from my experience, it's a good experience. It gets
Yeah.
you connections with people, and it is usually a less stressful environment, especially for the feelings of anxiousness that you've been having.
Yeah.
I think it would be a good step to like building a good support system.
Okay.
So given all of that, we're gonna close out for this first meeting.
Okay.
But just again, can we check in? Like, what are your thoughts right now? How are you feeling?
Sure. I mean, even just from this, I definitely feel like I have a bit more of a grasp on kind of what's been going on. You brought up some good points I didn't really consider with just like having to be perfect and having to strive for that sort of like ideal self so that you don't make queer people look bad. Yeah, I definitely think that kind of clicked a little bit, and that you bring up some good points. And I feel just in a better spot right now, even after just one session. So.
Okay, good. Okay, so we'll meet same time next week to go over homework and stuff. Does that sound okay? We're good?
Yeah, that should be perfectly fine. Sometime next week should work just okay.
All right. Well, it's been good to see you. I'll see you next week.
Thanks for your time. Appreciate it.